Good evening. This is Audra Gatz with WorldClassCME. We would like to welcome you to our webinar. We are excited to be here this evening with Dr. Megha Gupta. She will give the following lecture, Early, Accurate, Efficient, Leveraging AI in Breast Radiology Practice. A few items before we get started. You will receive an evaluation to your email at the end of the webinar. Please take a moment to fill it out. We value your opinion. Your CME certificates will be emailed to you as well in about a week. For our Q&A session this evening, we'll be using the question function in your Zoom toolbar. Questions will be answered at the end of the presentation. Now I would like to introduce you to Dr. Gupta. Dr. Megha Gupta is a board-certified radiologist specializing in breast and body radiology at Sol Radiology in Victorville, California. A passionate advocate for women's health, Dr. Gupta has been instrumental in transforming mammography diagnostics and expanding access to high-quality imaging services in rural Desert Valley communities. In 2024, Dr. Gupta was named to the Radiology Business 40 Under 40 class of 2024 in recognition of her leadership in integrating artificial intelligence into imaging workflows to enhance diagnostic efficiency and reduce costs. She spearheaded the development of a state-of-the-art imaging center designed to provide patient-centered care and foster trust within the community. Her initiatives have streamlined communication between referring physicians and radiologists, ensuring continuous coordinated care for patients. Dr. Gupta is deeply committed to raising awareness about the importance of annual screening mammograms and is dedicated to improving healthcare accessibility for underserved populations. Her work exemplifies a holistic approach to patient care and combining clinical excellence with innovative technology to improve outcomes and enhance the patient experience. Now, please enjoy Dr. Gupta's presentation.
Hi, everyone. Thank you for that introduction. Let me just share my screen. Okay, so I'm Dr. Megha Gupta. I'm a body and breast radiologist at Sol Radiology. The talk that I'm going to be speaking about today is leveraging AI in breast radiology practice. So this educational activity explores the evolving role of AI in breast imaging with a focus on enhancing clinical practice and patient outcomes. The learning objectives include differentiating modern AI tools from legacy CAD based on clinical evidence and real-world performance, evaluating the impact of AI on early breast cancer detection, diagnostic accuracy, and workflow efficiency, and identifying practical strategies for integrating AI into daily breast imaging practice to improve clinical outcomes. So I wanted to just give a little bit of background information on myself. I am a USC lifer. I did my college, medical school, residency, and fellowship all at USC. So I did receive really great training there. And then straight out of fellowship, I joined Sol Radiology, which was founded by me and two other partners. And I think the premise of Sol Radiology is that it is a radiologist founded group. So we're always looking for ways to improve our accuracy, to improve our efficiency, but never compromising patient care. And we always want to give timely reads and reports to our patients and referring physicians. We're centered in Victorville, California, but we cover about 13 hospitals in California and Illinois. And we have 2 outpatient imaging with state-of-the-art technology in Victorville, California. And I think one thing that's unique about us is that the 3 of us really strongly feel that artificial intelligence is the way to partner with for radiology. It's not going to replace us. It will just complement us. So we really have to appreciate the technology that's out there and really be able to use it to our advantage to make us more efficient, more accurate, because as a lot of you know, especially in radiology, there's an endless burden of shortage of radiologists with now an ever increasing amount of orders and backlog. So we really need to try to improve our own efficiencies. So that's something that our group really feels that is important, and we're constantly looking at ways to improve our efficiency with AI. So just some facts. Our annual screening mammograms is about 24,000, but just to put into perspective, since 2023, we did about 50,000 mammograms. And I am the lead mammographer, and I read about 35,000 of those mammograms. So, as you know, the volume is just endless. And so, you need to find those tools to help you to reduce burnout. So, our pain points are probably like some of you already have as well, which is a mammography backlog. And I think one way to improve yourself is just radiology efficiency. So, some facts: mammograms alone may miss cancers. About 20% are missed on screening mammograms. They may mask cancers. About 35% are missed in extremely dense breast. And they may result in a delay of diagnosis. And this fact is kind of astonishing that 60% of facilities report interpretation delays. And if you're a woman getting a mammogram, you do not want to be one of those patients that's getting your mammogram results a month later. So there are a lot of different AI tools. There's about 20 FDA approved AI tools for breast imaging. And now 1/3 of US facilities have adopted these AI tools. And I think this number is only just going to get higher and higher as AI is just becoming way more integrated into radiology. And I think finding the right AI tool results in a lot of trust. You have to be able to have trust in this AI product, and you have to be able to be open-minded and integrate it into your clinical practice. So that results in you being able to research different tools and making sure you find one that you're comfortable with. So there is a lot of evidence in support of AI. AI does assist in improving radiology performance, boosting early cancer detection and confidence in challenging cases. In a retrospective review, AI did detect subtle signs of cancer in 1/3 of interval cases, demonstrating its potential to enhance diagnostic accuracy. And this is the most important for myself and my group, is the efficiency part. AI-driven recalls are 8 times more precise, reducing unnecessary recalls and improving efficiency without compromising detection. So I don't know how many of you out there use CAD, but I really dislike CAD. I thought it really slowed me down and made me more inefficient because, as you can see in this example, there are so many things circled in the bilateral breast, both on the CC and the MLO views. And you can see with AI, there was actually nothing that was clinically significant that needed to be called back. So before I implemented AI into our radiology practice, I would kind of ignore the CAD because of the false positives. And AI alone has decreased the amount of false positives in comparison to CAD by 94%. So that is very significant. So what's behind the high performance of AI? It's basically the data. About all the algorithms are trained on a large curated data set of over 3.3 million images. And these images need to be diverse in including all different types of density of breast, from entirely fatty to extremely dense. It also needs to include diverse patients, including all different types of nationalities. So that's the most important thing that drives the high performance of AI, is the data set. I just want to go over my workflow before AI versus after AI. And it may be similar to some of your workflow. But before AI, it would take me about 10 minutes to get through a screening mammogram. And after AI, it takes me less than 5 minutes to get through a screening mammogram, especially because I know if AI is calling it negative and I'm calling it negative, we can go faster and move on to the next study. So before AI, I would first look at the 4-view 2D MLO and 2D CC in relative right side by side with a comparison. Then I would go over the tomo stack. And then I'd go over the 2Ds side by side with the priors. And then I would make my interpretation. With AI, I was always going back and forth. Should I look at the AI first? Should I look at it last? Is it going to, sway me one way or the other? But what I did find was putting my AI finding score first actually allowed me to be the most efficient. And it didn't sway me one way or another, but it allowed me to target what area AI was thinking was positive. So I can just take a second look at that area to see if I agree with its positive finding. And the other thing is that when I knew the AI called it negative, then I can scroll a little bit faster than normal. So that did decrease each of my mammograms by 5 minutes, which at the end of the day is very significant when you're reading hundreds of mammograms. So this is an example of how it looks. This is the AI software that I use. It'll show an abnormality score, and each lesion is ranked from 0 to 100, with the higher score indicating a stronger cancer prediction. And it'll also show not only a score, but also a color mapping. So the more red it is, the more likely it is to be cancer. And the higher the score doesn't necessarily indicate severity of disease. It doesn't mean that this is a more invasive cancer, but it just determines that this is more confident that this is cancer. And it will also not mark visible lesions, which are not suspicious, like say a well-circumscribed mass or a degenerating fibroadenoma with popcorn calcifications that CAD would otherwise mark. This AI software does not mark it. And then it'll even break it down further. So you have your mass, your abnormality score here, and then it'll break it down into an M, a C, or an M and C. M will stand for mass, pretty self-explanatory. C is for calcifications, and M and C is mass and calcifications. So it really breaks it down very easy for you. You don't really have to think too much about it. And then you'll have that score and the color mapping right next to it to determine the severity of it. And if there is no suspicious lesion like here, then there's going to be no abnormality marked. So this is just showing that more than 80% of screening cases will sit below the threshold, meaning that they won't be any abnormality score. And the default threshold in this software is set to 10. So this graph is just explaining that. This, I think, is a very positive aspect of this AI software and just other AI products in general, is this is a way to triage your list. It'll show up on your list with the abnormality score. So say you have a score of 90 and then you have a lot of zeros or, tens, then okay, maybe I need to read this screening mammogram first. That's a 90 because this is most likely to be a cancer. If you have like a list of 500 mammograms, at least you're able to triage which mammograms you should get to first, because that if you don't read those mammograms, then that's just going to result in a delay of diagnosis, delay of cancer detection, and a delay of treatment. And that could really significantly impact patient care. So this is really helpful, I think, in triaging. This is especially important in practices or groups with a big backlog. So this is just an example of how it'll show up depending on what packs you use. And I just wanted to also say something about packs is that, that is another aspect that you really have to choose the right packs in mammography, especially 3D mammography that makes you efficient and doesn't slow you down. I use a cloud-based PACS, which each mammo loads within seconds, and I can scroll within seconds. I do teach residents at a different institution remotely once a week, and I have to pre-cache maybe like 10 mammos for them, and it takes just like an hour just to pre-cache, and I just can never imagine having that be my practice if I'm reading, 100, 150 mammos a day of pre-caching that many mammos. So choosing the right packs is really important to improve your efficiency, in addition to, choosing the right AI for you. So you can click Show CAD, and then it'll highlight which masses are abnormal by circling them and giving the score. And then it'll also show the color mapping as well. And then it'll say like M or C for mass versus calcifications. And then I don't use this aspect too much, but you can hover over the mass if you want to get, more detailed information about it. But I don't find that useful, so I don't do that in my practice. And another good benefit of a lot of the AI tools, especially the one I use, is that you can jump directly to the slice. And, when you're scrolling through tomo images, sometimes it can get really cumbersome. So if you could just click that slice, scroll directly to it, then you can see the abnormality. But you obviously want to make sure you're scrolling through the entire mammogram for completeness sake. So I'm just going to go through a few examples of how this AI software will highlight the abnormalities. So this is an example of microcalcification detection, and it'll give you the abnormality score with the C for the calcifications. And this was an example of biopsy-proven DCIS, and the result was a true positive with correct location lesion marking. And this is, I think, one of our pain points in breast radiology is extremely dense breast tissue, and that's where we can really miss cancers. And AI performs really well in extremely dense breast tissue, and you can see that these calcifications, which are really hard to see, are highlighted given an abnormality score of 41C on the CC, 48C on the MLO, and this turned out to be high-grade DCIS. So this was also a true positive. And this is an example of just highlighting in a more heterogeneously dense breast tissue, a spiculated irregular mass. And you could see how high the score is. This is a 94. So on that color mapping, you'll see that it would probably be a red. And then other calcifications on the mammogram, like you could see these calcifications that are more benign appearing are not highlighted. And again, this was biopsy proven invasive ductal carcinoma of the right breast. And this was a true positive. So in this example, this is just showing that it won't highlight what it presumes to be benign. Like if it's a well-circumscribed mass, or like I mentioned, a mass with popcorn calcifications, because that would result in just an increase in recall rates and unnecessary biopsies. So I think the most important aspect of AI is that it increases your productivity. In just our practice alone, it has increased our productivity probably by 30% per radiologist. Just an example for you is that our practice was asked to help a group that was transitioning out in Illinois, and they had a 6-week backlog of mammograms. And they asked our group, because they know we have same-day turnaround times, we're really efficient. They wanted us to help them with that backlog. And only 2 of us were credentialed at this facility. And we were able to go catch up that 6-week backlog in 2 weeks. But my one condition to this site was, if you want us to help you, you have to implement the AI software that I'm used to using, because I know that's going to make me the most efficient and able to get through these cases. So it really does improve your efficiency and accuracy as well. So I think a few lessons that I've learned and want to just share with you in AI implementation is, number one, look for an AI partner you can trust. This, I think, is the most important one, because if you're not trusting your AI, then how could you believe it? Or then you're just going to doubt it. It's just like, trust in any sort of relationship. You need to be able to trust your partner in order to have the best success. So make sure you do your research, talk to people. I'm happy to give everyone my email. You can always talk to me, because I did a lot of research on different AI software, and so did other partners in my group. Just find someone you can trust. Number two, don't downplay the value of software training. I know we're busy, and I know time is everything for us, but you have to make sure that you know all the tricks and tools of the AI software that you implement to be able to integrate it to your practice. So really get that training from the AI company, and make sure you know all the little details to be able to optimize it to your practice. Number 3, be patient and view AI as complementary to your expertise. And I think this is important. Just as physicians, sometimes we kind of don't want to admit that some, computer-based system or software can be superior to us. And we're not saying that it is superior. I think we have to make it complementary to us. I feel like a lot of, radiologists, and even myself, probably before I encountered AI, was more threatened by AI, because you always hear AI is going to take over radiology, AI is going to take over dermatology. Like, are you scared of losing your job? So when you hear all of these things, then you feel more threatened. But I think as I personally started to use AI in my practice, I realized it's actually not threatening. It's very complimenting, and it's making me be a better radiologist, a faster radiologist, a more efficient radiologist. And I think at a time where it's only going to get worse and worse in terms of burden for the field of radiology, you really have to find the tools that's going to help you decrease your burnout. Number 4, educate referring physician and patients on the value of AI. So this is something that I was able to do a lot in my local community, although we do offer AI to our patients, even in the hospital setting. But I'm able to connect more with the referring physicians locally to explain to them about AI. We had a breast cancer event in October, and we were able to highlight and educate the doctors and primary care doctors. We invited even patients of AI and how we implement it, and to not feel that it's, AI only reading your mammogram, but it's AI with a radiologist being able to provide you the best results. And I think the most positive feedback I've gotten is from our referring physicians, in terms of them just being, they have actually a few physicians in this past few months have come up to me and have said, before Sol Radiology opened their outpatient center, we hadn't gotten this many positives for cancer in our patients. And they were thanking us for, thank you for finding these early cancers and really helping our patients. And I think what's important about number 4 is communication. Just being able to communicate well and effectively with your physicians and your patients. So that's something that's really important, especially, we're located in a rural community, so education is everything. Number 5, track cases where AI changed your decision-making to build confidence and trust in tool. And I think this really hits home to me, because I do remember, like, I would say on a weekly basis, certain cases that are so subtle. And then I follow up on the diagnostics that I called back on the screening with AI's help. And, we found like a 4 millimeter cancer in a patient. We found cancers that probably could be really undetectable by the human eye. And I think with the implementation of AI, you just feel more confident that you're giving the best and most accurate results to the patients, while also being very efficient at the same time. So that's basically my presentation, and I'm open for any questions at this time.
Okay, let's see. Our first question, what are some of the biggest hurdles your practice has faced or anticipates facing in adopting AI, and how have you approached them?
So I think, like I had just mentioned, some of the biggest hurdles was making sure that our referring physicians and patients were comfortable with the AI software that we were using. It's actually interesting, in one hospital setting, in our templates, we started including that we use the AI software. I thought that would actually help the patients, that, you're getting this AI review. And at our practice, we just chose as a group collectively not to charge our patients in addition for this AI, because we live in such a rural area. I just didn't feel right causing this disparity in, charging patients who couldn't afford it. So we just, as a team, made a decision not to charge patients for AI. But I feel like then some of the referring physicians or patients started to think that only AI was reading their mammograms. So I think that was a big hurdle, was just making sure that they knew, it's a radiologist in addition to AI reading your mammogram, because that was kind of some negative feedback there as well. And I think another big hurdle is you're just having to implement this whole new practice into your workflow. So that does take time, and you have to build that trust with this AI software. So that only comes with reading cases and with time.
Okay. For those who have used both traditional CAD and modern AI, what differences have you noticed in efficiency or patient outcomes?
So I think the most difference is, like I told you, I think I started to really not even look at the CAD after a while, just because it would circle everything, it would highlight everything, and it would kind of overwhelm me with all of the false positives that it would highlight. So I actually, even as my workflow and as I got busier, I would stop looking at the CAD. And with AI, it's just, with that 94% decrease in false positives, you really know you have more confidence in what's being called back is a true positive.
Okay. In your AI, a score of 10 corresponds to a 20% callback rate. What score would correspond to a 10% recall rate or a 7.5% recall rate?
What score? So, sorry, can you say that? I'm not exactly
Sure.
sure.
No, sure. In your AI, a score of 10
Mhm.
corresponds to 20% callback rate. What score would correspond to a 10% recall rate or a 7.5% recall rate?
I'm actually not sure of that.
Okay.
Yeah.
Okay.
I can get
Um,
back to whoever that person
okay.
question. I can get back. I can
Um,
ask the AI company.
okay, perfect. Um, how have your referring physicians responded to the use of AI in your practice? Have you seen changes in their confidence, referral patterns, or follow-up conversations?
Yeah, we really have received a lot of positive feedback from the primary care physicians and breast surgeons. And we have gotten more referrals, I think, to our outpatient imaging center. They have told me numerous times that we're finding the smallest cancers, that, they didn't really have this before our imaging center opened up. So it's really kind of very positive to hear that, because we are making an impact on this community. And something that's really unique is this patient who I'll never forget, but the AI that we use caught this 4 millimeter cancer, and probably with my biopsy, I probably removed the whole entire cancer. But the primary care physician was just so shocked that we were able to find this tiny cancer. And so she actually called me and wanted to get more information about how we practice and what AI software we actually use. And her and the patient wanted to make an article in our local newspaper to just highlight our imaging center and our AI that we use, which is really, really positive. And that article will be probably coming out in the future. But it's just nice to be able to know that you're making a difference with these patients. And this really does change outcomes. A 4 millimeter cancer versus a 2 centimeter cancer versus a cancer that has spread is, huge differences in what the treatment options are for the patient.
Okay. How has the integration of AI changed your confidence or decision making in complex cases, especially with dense breast tissue?
I would say AI has increased my confidence level, especially when you're busy and moving quickly, significantly. I think my confidence level probably has improved by 50%, especially when it's a negative mammogram in a patient with extremely dense breast tissue or heterogeneously dense breast tissue.
And do you advertise to the community that you use AI as part of your reading services, or is that just something they find out kind of after they've gotten their score?
So we really do advertise this because, like I had mentioned, we don't charge our patients. And there's a competing radiology center out here that does charge about $40 per exam. And we were initially going back and forth whether we charge, whether we don't charge. But like I said, in our community, it's just very rural. We didn't want patients to come in not being able to afford the AI, thinking that they didn't get the best results, going home not confident, like, oh, did something get missed because I couldn't afford that AI? So we just made a decision as a whole to not charge the patients. So because we don't charge the patients, we really rely on marketing and advertising our AI product. And we want the community to know that, you know, in this rural community, we're still offering you the best care, the best options at no extra charge. And we even offer this to our 13 different hospitals as well as at no extra fee as well to the hospitals. We just have educated those hospitals of which AI software, and it's up to them if they want to really advertise it to their patients. But we do heavy marketing on this.
Awesome. Well, that was our last question. So a huge thank you to you, Dr. Gupta, for that very informative lecture. We really appreciate your time and having you here this evening. We hope you'll join us for future webinars, and that concludes our presentation. We would like to thank Volpara Lunit for supporting this activity through an unrestricted educational grant, and a reminder that you will receive an evaluation to complete shortly, and your CME certificate will be emailed to you in about a week. Thank you so much and have a wonderful evening.
Thank you. And I just included my email to, I don't know if I put it under host and panelists. Oh, let me just do it under everyone. So feel free to email me, anyone at any time, about if you have any questions about which AI software I use, or kind of like how I chose which AI. And, you know, it's not just limited to breast radiology. We have implemented AI in all different modalities. So I'd be happy to share the knowledge that I've learned that's helped me and my colleagues improve efficiency and accuracy in our practice. So feel free to email me at any time. And thank you for everyone taking time out of your day to listen to me.
Thank you so much, everyone. Have a wonderful evening. Thank you, Dr. Gupta. Thank you very much.